Thank you for joining us. We will begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. We will also be hearing from Dr. James Hildreth, President and CEO of Meharry Medical College, followed by Ralph Schultz, President and CEO of the Nashville Area Chamber of Commerce. Dr. Michael Caldwell, Metro's Public Health Director, and Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department are here with us to help answer your questions. As a reminder, please click the raise hand button next to your name at any time during the broadcast to participate in our Q&A session. We will now begin with Mayor John Cooper.
Good morning. At midnight last night, the Metro Public Health Department's Safer at Home order went into effect, requiring all Nashvillians to remain at home to socially distance themselves from each other as much as possible, closing all non-essential businesses in Davidson County and limiting all non-essential gatherings of more than 10 people. In true Nashville fashion, your response to the Safer at Home order has been strong. Residents and businesses throughout Davidson County are following the important public health protocols to flatten the curve of the coronavirus in our community and to support our hard-working healthcare providers. The Safer at Home order was developed in close coordination with our regional healthcare systems, and I want to thank Dr. James Hildreth, President and CEO of Meharry Medical College, and an academically renowned infectious disease expert himself, for joining us again this morning to provide his insight on the importance of practicing social distancing. A coordinated response is the most effective response, and I want to acknowledge and thank Governor Lee for the action he took yesterday to accelerate our state's response towards the common goal of eradicating the coronavirus from our communities. Yesterday afternoon, I spoke with the mayors of Tennessee's other largest cities, Memphis, Knoxville, and Chattanooga, and corresponded with neighboring city and county mayors from Middle Tennessee about the importance of a coordinated public health response. I'm grateful to Ralph Schultz, President and CEO of the Nashville Area Chamber of Commerce, for being here this morning to represent thousands of employers and businesses from across the metropolitan area that understand the importance of adhering to the Safer at Home order in the name of public health. Businesses in Nashville of all sizes, our entrepreneurs, hospitality industry employees, musicians, gig economy workers, are vital to our economy. Many businesses and workers were affected by the March 3rd tornado, hard to believe, not quite 3 weeks ago, and thousands more are being hit now by the impact of COVID-19. The sooner we suppress the spread of COVID-19, the sooner we can get back to normal business. We are working with community partners in the state and federal government to explore all avenues available to us for financial relief to those affected by this public health emergency. I want to remind everyone who has the means to do so to visit the covid19.nashville.gov website and contribute to the COVID-19 Response Fund, which was created with the help of the United Way of Greater Nashville to support Nashvillians facing hardships during this time. And for now, I'll turn it over to Dr. Jahangir, the chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning, everyone. I want to start with an update on the coronavirus in Nashville. As of this morning, we had a total of 184 confirmed cases with a total of 1 confirmed fatality. That's an increase of 5 cases in the past 24 hours. Now, while this is good news for today, I want to be very clear. I do not believe this is the beginning of the downtrend of this virus. The patients range in age from 11 to 73 years old. Of the confirmed cases, 2 are currently hospitalized, and 154 cases are self-isolating at home and have mild and manageable symptoms. 27 people who were confirmed cases have recovered and are now cleared. Yesterday, Dr. Michael Caldwell, Director of Metro Public Health, issued a Safer at Home order for all residents of Metro and Davidson County. This order directs all Nashville residents to stay inside their homes and only leave if it is absolutely necessary. Based on what we have seen in our country as well as around the world, and based on what the science tells us, we are all indeed safer at home. Thank you to the thousands of Nashvillians and the many businesses who are complying with this order. Now, I know some of you have questions about why you have to do this if you don't feel sick. No one is exempt from this virus. Each of us has the potential to spread it to others, including those we care the most about: our husbands, our wife, our parents, grandparents, co-workers, and neighbors. It is, in fact, the best way to slow the spread of this virus is to socially distance. Think of the people you love. Think how you would feel if you spread this virus to them and stay at home. I know there are many questions about this order, and today I want to help you understand what it means. Under this order, if necessary, you can still go to the grocery stores, convenience stores, or big box stores. You can go to a restaurant for takeout, curbside, or drive-through service. You can get food delivered at your home. You can go to the pharmacy to pick up medications. You can go to medical appointments. However, please check with your doctor or provider first before going. You may provide care for a friend or family member. You can help someone to get necessary supplies. You may receive deliveries from businesses which deliver. And you can go on a walk, ride your bike, walk your pets, and go out in nature. But when you do these things, you must keep your distance. Remember, at least 6 feet between you and anyone around you. Here is what you should not do. Do not go to work unless you are providing an essential service as defined by this order. Do not visit friends and families if there's no urgent need to. And do not be close contact with those if you're closer than 6 feet from others when you go out. Some other important parts of this order. Daycare and childcare businesses will remain open. However, we ask the children of parents working in essential services get the priority first for these services. Hotels will remain open with only food pickup and room service continuing. Hospitals will remain open, but you cannot visit someone in the hospital or nursing home except for limited circumstances. Please check with the facility or go to their website for instructions before you go there. And essential services like banks and veterinary and pet supplies can continue as long as they adhere to CDC guidance on social distancing and hygiene in the workplace. Again, thank you to all citizens and businesses who have already taken these measures. For a more detailed list of essential services and to answer questions you may have, please visit covid19.nashville.gov. I also want to update you on our community assessment system. We have been working with Chief Swan and the men and women of Metro government, along with our hospital and medical school partners, to launch the assessment centers, and I'm very proud of how quickly we have gotten them to this place. We are prepared to open, and we will, when we have the supplies we need to assess patients, as well as the supplies we need to keep our healthcare workers safe. We all have seen the news about low availability of vital medical supplies in our nation, and we continue to work with our state and federal partners, as well as the private sector, to secure the supplies we need. We are fortunate that Nashville has a robust and world-class healthcare system, which is currently responding to the needs of our community. The community assessment system will be an additional resource as we fight this virus. As we work to get this system up and running, we need everyone in Davidson County to do your part. And that means stay at home unless it is absolutely necessary. You know, as I continue to say, we may be apart, but we are all in this together. And together, we will all make a difference. Thank you so much for your attention. I would like now to introduce Dr. James Hildreth, President and CEO of Meharry Medical College.
Good morning. I'd like to add some scientific context for the Safer at Home order that the Health Department has issued. There are 7 billion humans that live on the planet, and as far as we can tell, last December was the first time we encountered this virus. That means there's absolutely no what we call herd immunity to this virus, and that's why it's racing through the human population as it is. Over many, many thousands of years, we've developed immunity to many, many different pathogens. This is not one of them. The COVID virus belongs to a family with 39 members. What that means is there's every possibility we'll be experiencing this same effect, this same event again. That's why we need to take this very seriously and have a long-term strategy of how we're going to deal with pandemic viruses. And since there's no drugs available, no vaccines available, because again, this is the first time we've encountered this virus, that's why the social distancing and sanitization procedures are so important. And as I said before, protecting your T-zones is one of the most important things to do. The eyes, the nose, and the mouth represent the portal through which many viruses infect our bodies. So as often as you can, wash your hands, use hand sanitizers, because when you touch surfaces, those surfaces may possibly be contaminated with the virus and other things. The immediate strategy, as you heard, is to flatten the curve. What we mean by that is we have a limited number of hospital beds, a limited number of ventilators, and quite frankly, a limited number of healthcare providers who have the expertise to take care of patients who are infected by the virus. So unless we dampen the curve, flatten the curve, our system will be overwhelmed, and we can't afford that. The near-term strategy, I'm happy to report, is to develop a drug that can treat individuals who are infected. The World Health Organization, for example, has launched a new trial in 10 countries and thousands of patients enrolled to test 4 drugs that are already approved for other purposes. The rebranding or repurposing of these drugs represents a really hopeful strategy we have for finding a treatment for infected persons. The long-term strategy has to be a vaccine, and thankfully, unlike some other viruses, for example, HIV, that's been so challenging to develop a vaccine to, these viruses have a stable genome. That is to say, they mutate less frequently than other viruses do. So we have much more hopeful that we can develop a vaccine to this virus than other viruses. Please keep in mind that the fastest vaccine ever developed took 6 years, and that was Ebola. Most vaccines that have been developed took decades, 40 years, for example, for measles. So while we hope that we'll develop a vaccine, people need to understand that is a long-term strategy, and the near-term strategy, immediate-term strategies for each of us to do our part by social distancing and protecting our T-zones. I can't say that enough. The other thing is that the virus causes pneumonia, which means that it gets into our lungs, and the inflammation it causes makes it very hard to breathe. But we need to know that the receptor for this virus is also found in the gut. As a matter of fact, there are more receptors in the gut than there are in the lungs, and that means that some individuals may present with GI symptoms. So we need to be very aware that the lungs and the gut are hosts for the virus, and we need to be vigilant about looking for those symptoms. So I want to say that the scientific response to the virus around the world has been phenomenal. People have used, for example, supercomputers to recreate parts of the virus in cyberspace, and they can actually take all the existing drugs to look for those that dock to the viral proteins. And that means that we have every hope that very soon we'll have some drugs identified that we can put into trials, and in the next few months find a drug that treats the virus. But please understand that this is going to be a long-term or longer-term process, not just a few weeks, but a few months. But because of the attention given to this by scientific organizations all over the world, sometimes in partnership, I'm very hopeful that we will find a drug, and we'll find that fairly quickly. But in the meantime, 6 feet apart, protect the T-zones, your eyes, your nose, your mouth. Sanitize surfaces that are touched by multiple individuals as often as you can. And by all means, let's take care of each other and put this behind us as quickly as possible. And with that, I'd now like to introduce Ralph Schultz, President and CEO of the Chamber of Commerce.
Dr. Hilder, thank you, and Mayor Cooper, thank you for inviting me to speak in support of and for members of the business community. The Nashville Area Chamber of Commerce is unified with the Mayor's Office and other community leaders in supporting the Safer at Home order that took effect today. We are in unprecedented times for our local businesses, from the tornadoes that disrupted so many lives a few weeks ago to the global health crisis threatening our nation and our community. There's not a single Nashville business that isn't confronted with immense challenge. Many businesses are fighting to survive. Directing all non-essential Nashville businesses to close for the time being is a difficult decision for Nashville. However, the city is facing a critical moment when these actions can slow or reduce the spread of COVID-19 and protect the health of thousands of residents. For businesses, these residents are the heart and soul of their enterprise. Undeniably, being proactive now will protect our employees and businesses from much worse outcomes in the future. The sooner we slow the spread of COVID-19, the sooner we can get back to business as usual for our businesses and our employees. For the short term, small business and the tourism industry need our support. Hotels, restaurants, concert venues, and music festivals are a big part of our livelihood in our community. The people who work in these industries have already been deeply affected. You can help by ordering to-go or curbside from 120 restaurants listed on the covid19.nashville.gov site. To tourism and small business, we commit to join together with city leaders in support of you and your employees. For example, if you're an employee suddenly without your job, other companies have immediate job openings. You can find a list of these businesses on the website, along with information about the United Way of Nashville's COVID-19 Response Fund. If you own a business that's currently facing hardships, the U.S. Small Business Administration has a disaster loan program. Please visit the Community Partners page of covid19.nashville.gov for more information and resources to help. You may also visit the NashvilleChamber.com site for information on evolving legislation that may benefit your company or your employees. 2 webinars of interest to you. On Thursday at 5 p.m., a webinar on tornado recovery will take place as put together by the Entrepreneur Center in the Chamber. And then Friday at noon, a webinar on the coronavirus recovery for small businesses will also take place with experts available at the Chamber website, NashvilleChamber.com. The Chamber continues our work from our homes. You can reach us by phone or online as you always have. A return to business as usual will be aided by the unique qualities that define Nashville's business community. We are fortunate to have a robust and diverse economy. This balance resists downturns. Small businesses and entrepreneurship thrive in Nashville. These businesses adapt quickly to new circumstances. And we have a worldwide brand of music and being a welcome place. We are a desirable place to be. So, as we move forward, it will be important for you guys to understand, for everyone to understand, businesses care about their employees. They are continuing to work as they can and adapt going into the future. And speaking for the Nashville Chamber, we care. We are dedicated to being a part of the solution, and we know all of us in Nashville are going to emerge stronger than before. We'll exceed expectations. Thank you.
Thank you, everyone. We will now start the Q&A portion of today's briefing as time allows. You can click the raise hand button next to your name. From the podium, I will announce your name aloud, and you may proceed by asking your question on the air. We will start with Blake Rosnowski. Blake? You can come back to Blake. Holly Meyer.
Order apply to the pastors and...
Can you start over? I'm sorry.
Sure. How does the Safer at Home order apply to the pastors and church support staff who have been live streaming their online only worship services in their church buildings? Can they still do that? And are there any other exemptions for the religious community?
Dr. Jungir?
Holly, thank you for that question. In short, the order says that people, we cannot have mass gatherings more than 10 people. Mayor Cooper and Dr. Caldwell and everyone encourages people who want to have congregations and to worship to do it online. We actually are very supportive of that, and that's kind of our understanding of that. Thank you.
Ian Jong with the Tennessean.
Hey, thanks, Chris. I have a two-part question here. The first is, can you share what you think the reason is for the small amount of new positive cases? Is this a result of fewer tests in this reporting period? And as a quick follow-up, Governor Bill Lee said last week that the state would start reporting the number of total positive cases and total tests done by private labs. Does Metro plan on doing that as well?
Yes, thank you so much. Regarding the number of only 5 positives for today, I think you've said it right. I think that part of that has to do with the function of the number of tests that were conducted yesterday and the results that were received. The Metro Department of Health will report tests conducted once we're able to compile those. As of right now, we are slowly starting to get that information in about the number of negative tests conducted, but we are focusing our efforts on making sure that the tests that are positive, those individuals are contacted, and that the social tracing that needs to happen happens. And so we really are focusing our staffing efforts right now on making sure that we do the correct epidemiologic and make sure our community is safe.
Tosin?
The first is, how do you plan? Do you hear me now?
Yes.
Okay, I have 2 questions. How do you plan to enforce the order? And are there any kinds of penalties people would face if they don't obey the order? And secondly, are Metro police officers being able to get tested for the coronavirus? And if not, why not?
Well, good morning, and thank you for your questions. It's very important to understand that enforcement begins with education and intention. I encourage everybody to go to covid19.nashville.gov. Read the orders. They're very comprehensive. Below that, there are frequently asked questions, so go through those. And if you still have questions, there's a button to be able to ask your question. In addition, there is email that I'll give you where you can directly ask your question about the order, and that is safeathome@nashville.gov. safeathome@nashville.gov. Once we have an education period and we are sure that everyone is approaching this with good intention, we will then use a measured approach through our already existing enforcement system at the Department of Health, starting with our Environmental Health Department. We will then be using additional assistance with all Metro agencies as needed. The question that you asked about police department or any frontline provider, healthcare provider, we want to make sure that if anyone has any symptoms, that we prioritize them to get tested. The number of testing kits in the community and across the country are limited, and the CDC is prioritizing that, as well as our health system, to assure that we can test those who are on the front lines. We're going to do everything we can to make sure they get tested and are protected to help take care of us. So thank you.
Damon Mitchell.
Hi, this is Damon with Nashville Public Radio. Two questions. First, could you just clarify if drive-through restaurants can remain open? And secondly, as far as the assessment centers, I know that you all are waiting on the appropriate supplies. Could this be days, weeks, or months? Could you just kind of elaborate on that?
Dr. Jungier.
Thank you for the question. First, yes, drive-through restaurants as well as takeout, curbside, and delivery are strongly encouraged. Please support our local businesses. Regarding assessment centers, we want to open these assessment centers as quickly as is possible, but I want to be very clear. We will open up when we have the correct amount of supplies to make sure that both our patients are taken care of well, as are our healthcare workers. So to answer your question of timeline, I will tell you as quickly as possible, but I think this is a greater national issue, the supply issue. So I wish I could give you a clearer answer than that. Thank you.
We have time for one more question from Hannah McDonald.
Hi, yes, Hannah from News Channel 5. I am curious to find out when people are tested, are you asking if they've been doing certain things? Are you recording their activities to try and figure out where people are contracting the virus?
Dr. Caldwell.
Well, that's really a great question because it goes to the heart of what we do every day at the Department of Public Health. There are a number of communicable diseases, and we have a very robust group of professionals who know exactly what disease that we may be facing and what the risks are, and ask the appropriate questions to try to track down people's exposure, to do contact tracing of people they may have been exposed to understand how a particular germ is transmitted. Now, in this case, with coronavirus, we know it is respiratory. And also we want to know specifically people that they have been around for more than 10 minutes in close quarters, where they live, who lives with them, any large gatherings they may have gone to, where they work. So every single person who tests positive or is being tested, we make sure we do our best to do as robust a contact tracing as we can. Because then if we do that, we can then identify other people and alert them sooner than later that even though they don't have symptoms, that they should take extra precautions and be aware that they should make sure they adhere to our current order, which is to try to stay at least 6 feet away from everyone. Thank you.
We were able to address all of the media questions in the queue at this time. A video recording of this broadcast will be made available later today. Thank you, everyone, for joining us. This concludes today's Metro COVID-19 press briefing.